Okay. All right. Welcome, everyone. We are going to look at introduction to epidemiology. We want to know what epidemiology is. Why is it very important that we know the principles of epidemiology, the different branches of the scope, and then we shall also look at the history of epidemiology, and then we look at how epidemiology is being practiced currently. Okay, what are the current practices in epidemiology, or what you can call the contemporary practice of epidemiology? So that is going to be our discussion in this session. So epidemiology comes from three words that we have just broken up here. The first one being epi. Epi means it's a Greek word that means among. Okay, and then demos means people, and then logi or logos, which is basically about study. Okay, so there are several definitions for epidemiology, but I've picked this one, that epidemiology is the study of the distribution and the determinants of health and health-related states in specific populations, and the application of this study to control health problems. Okay, so I've gone at length to really go through this definition word by word, such that we really get to know what epidemiology is. And in our subsequent slides, we are going to explain each of the phrases and the words that we have put in red. Okay, that from the start, I want you to know that epidemiology is a scientific discipline that underpins public health practice. The practice of public health depends on a lot of knowledge that is generated from epidemiological studies. So without conducting epidemiological studies, the practice of public health is actually limited. Okay, so epidemiology gives us the ground to be able to practice public health. So let's understand the definition. Let's talk about the phrase distribution, or the word distribution. Here, we are interested in knowing the frequency and pattern of health events in a population. What this basically means is that we want to know how many people are having particular health conditions or diseases. Okay, so how many people are having particular conditions or diseases? Where are they? Who are they? Okay, when do they get these diseases? So basically, with distribution, we are answering the questions of how many people are facing what conditions. Okay, and then we're answering the question of when do they frequently get this condition. About either is it a particular season, is it at the start of the year, is it at the end of the year, is it during festive season, what patterns are there? And then we check up issues to do with places. Are they people who live in the mountainous areas? Are they urban people, or they are rural people? They live in rural areas. And then who are they? That's the person. We want to know, are they adults? Are they young ones? Are they pregnant women? Are they disabled women? Are they widowed women? And things like that. That's what we want to understand. Okay, it's very important to understand all these dynamics such that we can be able to respond in an appropriate way. So we are looking at health events, and the term health events relates to either the diseases that are affecting them or anything that is actually impacting on their health. It could be exposures to chemicals that could cause abnormalities or any other thing. It can be behavioral that is linked to a particular health outcome. So that is the distribution aspect of the definition. So let's look at the other part. The other part also looks at the word determinants. If we go back to the definition, there is a phrase determinants of health. So that's what we are trying to explain here. Here, when we talk about determinants of health or socioeconomic determinants of health, we are basically referring to those factors that influence health, and they are issues related to where we work, the amount of money that we get, where we stay, where we go to school, where we even access social services or healthcare services. So the things around us influence our health, and that's why we are calling them determinants of health. So they could be social, they could be economic in nature. So that's why we talked about the nature of jobs that we do. They directly impact on the income that we have. The level of education that we have directly determines the nature of jobs that we can get, and therefore also determines how much money we can be able to get at the end of the day. So all these things actually influence the level of health. Okay, so we want to know these factors in a given population, okay, such that we can be able to know that these people are worse off or they are doing well. Okay, and then the other part is what we call health-related states or events. So when in epidemiology and public health in general, we usually use that phrase a lot in our literature. Basically, the issue here is that people's health or population health is affected by a number of things. It could be an earthquake, it could be an outbreak of a disease, it could be war, it could be an economic situation that has really disrupted the forces of supply and demand of health services, and therefore directly impacts on the provision of healthcare services. So if we use the phrase health-related states or events, we are basically referring to all those things that are basically related to health. Okay, all those things that are related to health. In this case, you can talk about diseases, the occurrence of diseases, and of course diseases can be classified into communicable and non-communicable diseases. And then we also talk about risky behaviors, okay, smoking, sleeping with multiple partners, drinking alcohol. These are risky behaviors. We still need to know them. We also have instances that, for example, mental disorders, which may not be directly classified under the two categories of diseases. We also have injuries that could be caused by, for example, road traffic accident. We could also have injuries that are either intentional or unintentional, issues to do with suicide, for example. All these are health-related events. Okay, so matters that directly impact directly impact health, we usually call them generally as health-related events. Okay, so that is that. So in public health, especially epidemiology, we use that word to describe all these events. And so this is therefore to tell you that epidemiology is not only concerned with the particular diseases. It is concerned with almost everything that impacts health. And this is where you will actually see how broad epidemiology is and the different divisions or branches of epidemiology. And then usually the interest of epidemiology is to understand what is happening in particular groups. And this is where we talk about the concept of disparities, health disparities. We have people or groups of people that are having poor health outcomes compared to others. Okay, it could be poor communities versus communities that have higher levels of income. So the two communities are not going to be the same in terms of health outcomes. Most likely you'll have higher mortalities in the poor communities compared to the well-off communities. And therefore, if we use a blanket analysis of populations without dividing them into different groups, we may not be able to identify some of the communities or groups that are disadvantaged. So that's where specific populations come in. Okay, are we looking at a particular region? Are we looking at a particular sex? Are we looking at a particular community based on their levels of income? Is it about ethnic group? Is it about the elderly? Is it about the orphans? Is it about social groups or social institutions like churches or schools? So when we look for these health problems or health-related matters, we look at them in particular groups. Okay, even at the at international level. Okay, global health, for example, the levels of analysis about countries, we look at, we compare countries in Europe, countries in Asia, countries in Africa, and then we say, okay, for example, majority of the mothers who die due to childbirth-related complications, most of them are from sub-Saharan Africa. Okay, so that tells us that the biggest problem to do with maternal mortality is actually in sub-Saharan Africa. So that type of analysis where we have these groupings enable us to really put our resources where we need them most. Okay, so that is where we focus on specific groups. And then the other aspect is to do with the application of what we gather in epidemiology. So if we are to connect well, what we do in epidemiology is that we look at the patterns and distribution about health-related events and the determinants of health in specific populations, and then use that to improve the health situation of that population. That is what epidemiology is. Now, so that we are now on the application aspect. We don't just gather this information, we use this information to improve population health, the health of the population. So remember, above we have looked at which population is that, specific populations, and then we gave the examples. Now, after getting this information about this specific group, then we basically design interventions to improve the health status of this special group such that it can actually match what others are having. Okay, so again, it's basically the same thing. What do epidemiologists do? We can say epidemiologists are like detectives. They investigate disease-related events. Okay, so that investigation yields answers to who is suffering from what, and where are they from. Okay, and then tells us so we have if I'm to write this, It tells us what diseases are affecting the people. Okay, this pen is not very. Tells us what diseases are affecting particular people. We can call them diseases, we can call them health-related events, we can call them risk factors. What is generally happening in terms of health? Okay, so if we ask that general question, it means that we are not only focused on the disease patterns alone, we are also looking at the people who are dying, that is mortality. We are looking at how many people are having particular diseases, that is morbidity. We are also looking at aspects to do with what diseases, the nature of the diseases that are actually breaking out, disease outbreaks. And then we also do the epidemiologists do investigations of disease outbreaks, like that they know where these disease outbreaks happen from and what measures can be put in place to make sure that the outbreak is contained, and then also evaluating those measures. Are the measures actually working or they are not working? So epidemiologists actually answer a lot of questions related to population health conditions. Okay, if we have a community A and you want to understand the level of health that that community is having, you ask yourself questions and then you can look for information about those such that you can answer those questions. And that's exactly what epidemiologists do. So they check what is the prevalence of diseases, what diseases are actually happening in the particular community, what outbreaks have been happening for the last few years, or what diseases are actually emerging, what are the risk factors, the nature of risk, the prevalence of risk factors or risky behaviors among a particular population, what can be done, that is about designing interventions and then evaluating these interventions and seeing if they actually work. So basically that gives us the functions of epidemiologists. Okay, so epidemiologists all do this work. You just need to remember that they're basically like disease detectives. They want to find out what is happening in communities and populations, and then in reacting to that. Based on the information, they design interventions. Apart from designing interventions, they evaluate these interventions. So they do a lot of work in policy design, determining the level of health outcomes, or determining health outcomes for particular populations, identifying which people are actually worse off, that is identifying disadvantaged groups, and then issues to do with determining mortality, the level of mortality and morbidity in a particular community. So it's like just having a torch and then you light it upon a particular community such that you can get to answer all those questions. Okay, that is what epidemiology is concerned with. So